Hi, I'm Deborah Pollard. I'm an advanced nurse practitioner in haemophilia and bleeding disorders from the Royal Free Hospital, London. I'm fortunate enough in a long career in haemophilia to have seen many changes and advances in practice and in treatment and management of haemophilia, but none more exciting than the advent of gene therapy. And I'm here joined by Luke Pembroke today to talk to you about his personal journey.
Hi, my name's Luke Pembroke and I have haemophilia B, and last year I signed up to receive gene therapy as part of a clinical trial.
I want to take you back a little way, first of all, to thinking about how you came to make the decision to embark upon gene therapy.
So that's a good place to start for me because it's something that I always try and emphasize to people when I talk about my gene therapy journey, and that it was not a snap decision. It wasn't that I found out about a gene therapy trial and then wanted to immediately sign up, take part. I first heard about the gene therapy trial through my consultant at one of my routine visits, and that was towards the end of 2018. And I was curious, so I got some of the initial blood tests done after having a conversation with my consultant to check for any neutralizing antibodies, which of course, if I had those, I wouldn't have been able to take part. That came back all clear, so I could move forwards with the trial procedure. And over the Christmas break, I spoke to friends and family about the idea of doing gene therapy, and I spoke with work, and I looked what I had on for 2019, and I looked at the trial protocol, and I just knew deep down that there was no way I could commit to the trial because it is a big commitment. There are a lot of visits involved, and you have to give up quite a lot. So I knew it wouldn't be fair on myself, and it also wouldn't be fair on the people working on the trial to sign up to something I couldn't go 100% in on. And towards the end of 2019, the conversation came up again with my consultant, and I'd had discussions throughout the year repeatedly about gene therapy with people close to me. And looking at 2020, I realized, actually, I can make this work. I think I'm ready to give it a go. So I went through the same process, and I went to the Royal Free Hospital in North London, had the same blood tests done again to see if within the space of a year I'd picked up those neutralizing antibodies, which I hadn't, which was good. And then I was given an initial dosing date in January. However, someone had passed screening before me, so my dosing date got pushed to February. The time flew by very quickly, and I read the protocol countless times. I'd had many blood tests already done, and I was given the date 11th of February to receive gene therapy. And the rest is history, I guess, from that point on.
If I take you back a little bit through that 18 months that you've described of preparation, thinking about the people that you spoke to, you said you spoke to friends and family and those that were close to you. How did those conversations go?
They were interesting because it was the first time in a while that I'd spoken about my haemophilia in such detail with those closest to me, because I manage my haemophilia quite well for the most part, and I am just an ordinary guy day to day. So one conversation that sticks out that I had with one of my best friends was about enrolling in gene therapy and what that might mean and the potential to not have haemophilia anymore. And I sort of jokingly said to him, if I don't have haemophilia, what do I have? Like, what's my edge? That's the boring thing I always bring up at parties to talk about. He was very enthusiastic about the idea of me signing up to the trial. I remember he said, well, Luke, if you do gene therapy and turns out you don't end up with haemophilia, you're still just Luke. You're just Luke to me. And I think being so involved in the advocacy world, it's easy for a lot of my personality to get tied up in the haemophilia side of things. But having those conversations with people that weren't as involved, I found the most helpful. Of course, I had conversations with nurses and doctors that I knew, and that was really helpful to bounce off of them to understand the level of commitment to the trial, the science behind it, and as someone who's a bit of a science nerd, I really appreciated that. But understanding what the social impact of it might be, having conversations with best friends, my brother, really were helpful in making me feel confident that I was making the right decision.
So having made that decision to go forward, can you tell me a little bit about the consent process for embarking on the clinical trial? Because I understand it is a lengthy process.
Yeah, it definitely was. I mean, the amount of paperwork and protocols I had to read were a lot, and they are intense and they were crammed full of information. And I was given a lot of opportunities to ask questions. I wasn't just handed the information, came back in to see the team, and then asked any questions, and that was it. It was several visits where I constantly felt like I had an opportunity to ask questions, receive more information, take that away, process it, come back, ask more questions. And then in the run-up to getting dosed, the week prior, I spoke to an independent patient advocate that was arranged through the Haemophilia Centre, and he came down and had a conversation with me. And it was a relatively informal chat, but he had his checklist of things to run through to make sure that I really understood what I was signing up for. And I did appreciate that sort of formal checklist element of it. It gave me an opportunity to voice what maybe my biggest concerns were, what were the risks that I was most worried about.
Thinking about the dosing day, you've already said that the date was set in advance. What was the day like for you?
So I'd heard this before about other people who'd gone through the trial. I thought maybe I'd be different, but in a lot of ways it was very uneventful. I was in the day before dosing for all the pre-screening bloods on the Monday, and then I was dosed on the Tuesday. And the dosing itself kind of took me by surprise. So as a lot of people in the community might know, I've documented a large part of my gene therapy process on social media, with permission of the centre team, of course. And I was setting up my cameras to record me receiving the dose of gene therapy. And all of a sudden my nurse turned around and went, "Luke, sir, we're ready to go. Sit in the chair." I was like, "Wait, that's it?" And it was just the sofa in the centre, IV bag hooked up, nothing sci-fi by any means. And I sat down and I was like, "What is happening right now?" And it's like, "Yeah, are you okay?" And I was like, "Yeah, I'm fine. It just feels like so uneventful. It is just being hooked up to a cannula, and then the infusion happens over the course of an hour." And I did feel a lot of different emotions during that hour of receiving the infusion, and nurse was coming in out of the room, so I had a few moments to myself, and I did start thinking about what this might mean and what a significant moment it was in my life still. But in terms of how it all looked, it was a very ordinary feeling. I wouldn't say I felt nervous. I wouldn't say I felt excited. It was just sort of butterflies in my stomach feeling I'd get before an exam was the only thing I could compare it to.
And you've already talked quite a bit about the fact that you prepared for many months for the trial, and you felt well prepared, and you felt that you had investigated the trial protocol well. How do you think, looking back on it, how well prepared do you think you were for the commitment that is needed for a clinical trial for gene therapy?
I knew it was going to be intense and require a huge commitment, but even then, it still took me by surprise just how intense it was. And being in the middle of the trial, realizing that things can change. There were points where certain elements of the protocol had to be adjusted, and I'd have to go through it again because for the purpose of the trial, they wanted to extend the time I was on the immunosuppression at one point, or they needed to take some extra bloods because after receiving gene therapy, I went to the gym and maybe lifted weights a bit too heavy, and that caused sort of proteins to elevate in my blood. And realizing that whilst you have this protocol and these are the dates that you have to come in for your blood tests, it's not set in stone. And I often jokingly said to the team whenever I was in that it's as much of an art as it is a science when they're doing these revolutionary gene therapy trials. And of course, there's no avoiding the fact that I decided to sign up to do gene therapy in 2020, and well, we all know how that went. And being on considerable doses of immunosuppression just as a global pandemic kicks in isn't ideal.
We should put into context for the purposes of this record that actually you were the last patient enrolled in a gene therapy study prior to a major lockdown in the UK when all clinical trials were halted because of the COVID-19 pandemic. So that had a very unique perspective for you.
Definitely. And it's always going to be something that I have to acknowledge when I talk about my gene therapy experience, because it had such an impact on how I experienced the trial, having to go into shielding. The only other human beings I saw for months were my nurse and doctor, and my life was the clinical trial. The only time I left the house was to go in for my blood tests, which I found weirdly exciting because it was the only time I could get out the house. So I never thought I'd look forward to blood tests, but that was my day out.
So I think that that's quite unique to you because of the circumstances you found yourself in. But what would you say to the community generally about your participation in a clinical trial, putting the pandemic to one side and the fact that you were shielded?
Even if the pandemic hadn't have happened, it still would have been such a huge commitment. I recognised only a couple of months ago that whilst I'd said to my centre team that I'd really like to go to WFH, even though it was cancelled, if it had gone ahead, I couldn't have made it there. It wouldn't have been possible. The follow-up bloods required at that point in the trial were very regular. I was going in 3 times a week minimum. And I was on high doses of immunosuppression, which do not make you feel well. So travelling to Kuala Lumpur for WFH wouldn't have been possible. And this is what I think people in the community need to recognise, that it isn't just one shot, I've had gene therapy, off you go, come in now and again for a blood test. It's a lot more intense than that. And we do hear about clinical trials that have happened in the past in haemophilia, but it's a whole different ballgame when it comes to gene therapy. Still very small numbers of people have received this treatment, and we need to find out whether it's safe and effective, and that's why this intense amount of follow-up is necessary. And if you're considering gene therapy or signing up to a clinical trial, you need to recognise that it is a big commitment and it will require you to sacrifice quite a lot in your everyday normal life.
You alluded to some of the side effects. I think that's really important to share with the community because most of the clinical trials at the moment have a degree of some adjunctive therapies, such as steroids, prednisone, for example. What were your experiences of being on these immune suppressive drugs?
So I've said many times now to people who've asked about the immunosuppression that being on prednisone and tacrolimus made me feel the most ill I'd ever felt in my life. And I think that shows that I've been quite fortunate growing up with haemophilia and not experiencing what other members in the community from different generations had experienced. But for me, it was a completely new experience to feel that unwell from receiving a medication. Factor doesn't make you feel unwell. And that's what I'd had my whole life. And then to suddenly be off of Factor, have taken gene therapy, but are then required to take these medications that come with some nasty side effects, really did knock me for six. I was struggling quite a lot the first few months I was on the immunosuppression. The list of common side effects on the labels. I'm pretty sure I had 99% of them, and I just didn't feel like myself for a long time. And they affect you physically and mentally. And that's, again, emphasizes just how much of a commitment and the level of sacrifice you have to make if you decide to enroll in a gene therapy clinical trial.
So moving forward a little bit, and looking backwards at the same time, tell me what's changed since you had gene therapy.
So it was really hard to see through the fog of last year. My life was just focused on the trial, and that was it. It was making my blood test appointments, really feeling like I was a part of the clinical trial team too, which was good. I even got to take my own bloods at one point during the height of the pandemic when it was best for me to not go into the hospital. So there I was, having received gene therapy, I was still accessing my own veins, which again, a lot of people might think after gene therapy, you don't have to worry about injections anymore. That's not the case. If anything, you probably have more needles in your veins than you've ever had before. It was only sort of around the start of this year that I had a chance to evaluate where I was and recognise at the year anniversary mark of receiving gene therapy that, oh wow, I haven't had to take a single dose of factor in over a year. And then started thinking, how could I go back to that? Would I be able to go back to that? Would that upset me? Because it just became part of my everyday life to take my prophylaxis.
Yeah.
And I was injecting 3 times a week, and I got used to it. But now that I haven't had to do it, I'm really starting to recognise just how much of a difference it makes for me. Being able to go to the gym or go for a run, and I still, to this day, I'm still going, oh, have I taken my treatment? And then I go, oh no, I don't have to. I can just go out. Or going to meet friends at the pub on a Friday, and as I'm leaving the house thinking, oh, have I factored up? It might be a late one. And then I go, no, I don't have to. It's a hard feeling to describe when your whole life has been structured around making sure you take your factor. I'd heard this said before in the past, and it really resonates with me now that I didn't know I needed it until I had it. And I think there's this pressure with gene therapy when you've had it to speak to people in the community, and they expect you to be so thrilled about it and it's changed my life, it's amazing. And I don't think I outwardly speak about it like that, but when I really reflect on it, it has significantly changed my life for the better, I would say. On the flip side, being in the trial for the past year has meant that I've thought more about my haemophilia than ever before.
Okay.
Which has been an interesting experience. It wasn't an easy year, but now I just love the fact I don't have to sit down several times a week and mix up my factor and stick needles in my veins. It's, as much as we adapt to it as haemophiliacs, it's not normal. It's not normal for someone to have to sit down and inject themselves, but we just make do. So not having to do that has been amazing. Not having to worry about whether my ankle is bleeding and knowing, no, my levels have got me covered, and starting to learn to put trust that the gene therapy is protecting me. It's a process and it's been a journey, but I'm starting to get used to it, I think. I'm starting to get used to my new normal.
And does your new normal ever include a haemophilia-free day? Do you have a day where you don't think about haemophilia at all?
I think I've had a few haemophilia-free days more recently. I'd say that's quite a new thing, because when the follow-up bloods were more frequent last year and at the start of this year, it was very hard for me to not think about haemophilia. One thing I recognised is that it's very abnormal for someone with haemophilia to receive their factor levels multiple times a week, weekly, or even monthly. We would usually only receive those twice a year to understand what our PK was, what's your peak and trough, and that was it. You go away, you don't think about it. And suddenly when you're bombarded with data for a year and then it's reduced and pulled away from you, I found myself in the weeks between blood tests, wondering, oh, I wonder what my levels are at. I really want to know. And it generated a little bit of anxiety. And I'm getting better with that now, but it did make me think about how much of the data do participants need to know. And some people might appreciate more information, but for some people it might be very overbearing. And so I think that's something people working on the trials need to consider and approach it on a very individual basis.
You've already revealed publicly that you're living with mild haemophilia effectively because of the level that you've sustained. How have you adjusted to living with mild haemophilia?
So I guess the first thing I'll say is I was briefly in the normal range. I was above 50% for a fair few months. And it was interesting to consider myself normal. And when my levels fell below 50%, I would be lying if I didn't say part of me was quite disappointed. But I always knew that was a possibility, and I'd prepared myself for that, and I had my expectations of the trial, and I was very modest with them, I think. But again, it comes back to learning to have faith in the fact that my mild levels now protect me from quite a lot. And adjusting to being a mild haemophiliac is very interesting because I'm still not used to leaving the house without thinking, oh, I need to do my injection. It does make me think about the possibilities of living with this new phenotype, that hopefully I'll be able to travel again and go to the airport and not be carrying an extra bag of Factor, or just going out and not having to think about it and starting to get back in the gym and going running more and not having that sort of niggling in the back of my head that be careful, you might cause a bleed here. So it's been hard to get my head around that. It's been a nice thing to try and get used to, I won't lie. As I said, it just makes me think about more possibilities and that I might have a bit more freedom in what I want to do moving forwards.
You've talked a lot about preparing for the trial. What were your expectations and motivations for taking part in a clinical trial for gene therapy? So
I went in with fairly modest expectations because I recognised it was a clinical trial and a phase 1/2 clinical trial. So primarily they're trying to figure out if it's safe, and then secondary to that, if it's effective. But there are no guarantees. And so I went into it not expecting to be cured. If that happened, amazing, that would be great. I didn't want to build up this idea of gene therapy being this haemophilia cure and solving all my problems. I got involved in the trial because I felt like it was a worthwhile thing to do. And I'd heard about the people who'd signed up to the earlier trials before me and people doing it for very altruistic reasons. And I think a lot of my motivations were somewhat altruistic. I really do hope to forward the understanding of gene therapy and the science, and I'm glad to have played a small part in that. And I'd gone to so many conferences in the haemophilia community in the past where I hear researchers and doctors talking about known unknowns and unknown knowns, and I can't remember all the combinations of them, and all these hypotheticals. And at the end of the day, if it isn't for people like myself in the community that sit down, get hooked up to this IV infusion and give it a go, we're never going to find out. We need people to take part. And I consider myself to have been very lucky and had a pretty fortunate life as someone with severe haemophilia growing up. And I felt like I was in a privileged enough position to sign up to this trial and take part in it. And so my biggest motivation was just trying to move things forwards and be a part of that. I hoped I would get a positive result, and so far so good. And I really do believe it's something that can have a huge impact for people in the future. The one thing I will say is, especially within a clinical trial context, if you're considering gene therapy because you want to get rid of your haemophilia, I don't think that's the right motivation. You need to recognise that it is still a clinical trial. There are no guarantees. And in my early 20s and late teens, I didn't relate very positively to my haemophilia. And I don't think I would have been mentally in the right place to sign up to a gene therapy trial then. It took me a couple of years to somewhat make peace with my haemophilia and acknowledge that whilst haemophilia had taken some things away from me and caused me some issues, that it's something that lives with me. I don't live with it. And once I got to that point, I think that's when I was able to consider a gene therapy trial and go, let's give this a go. Let's try and do something good for the community. Let's hope I have a positive result myself. But if it doesn't work out and I don't get the best result, at least I know how to live with haemophilia and I know how to handle it. But hopefully it does stick around because I'm enjoying life as a mild haemophiliac.
Luke, where do you see gene therapy for haemophilia in the future?
I hope to see it more widely available. I believe that we're going to start seeing more positive results as we understand more about how it works. I really hope to see it expanded to not only people living within the developed world. I think gene therapy could have an even greater impact for people living without access to the currently available medications. I hope to see a cure one day. I think we're all holding out for that. I would like to see haemophilia not be a thing anymore. And whilst that sounds ambitious, I think about how much has happened in the last 2 decades of haemophilia treatment and how it's exponentially got better, and there's some amazing science going on out there, not only gene therapy, but other alternative medications for haemophilia. And I believe we have the brains and the people working within haemophilia to make that a reality. And I hope to see it one day, maybe when I'm an old man and I'm sat there in my rocking chair thinking about when I signed up to gene therapy, and then all of a sudden I'll see something on the news that haemophilia is no longer a thing. They've fully solved it.
Thank you so much, Luke, for all of your insights into participating in a trial for gene therapy for haemophilia and for sharing your story with us today.